Dearie me. Thank you. Results, okay. There are only two roads to the same end. The results are the same, and elite and authoritarianism as such will gradually form on society so gradually that it will not go to chaos. And most people would accept it. Now that's Francis Schaeffer speaking, writing in 1984, right at the height of Ronald Reagan's presidency, right before he was about to get reelected. For when some people think the religious right in the United States was at its zenith in terms of political power. And yet Schaeffer observed that in terms of Christian defenses of human life, there was very little to be found among Reagan, any more than it was to be found in his predecessor, Democratic predecessor, or those since on the issue of abortion and so forth. I mentioned the Holocaust because the Holocaust, which is being remembered today, was preceded by something a little less commonly known. Can you go to the next slide? I think it's the next slide. I just put yes, something called Action T4. It's Action T4, which involved the systematic killing of individuals as part of the Nazi Germany's eugenics program. So here's where I'm coming at it. I think that euthanasia is the dark side of eugenics. It always has been. And it is to this day. Eugenics is, the word is there, is to produce, retain, cause to thrive the healthiest human beings, the most worthy of life. And the Nazis, Action T4, 300,000 disabled people were killed. That was leading up, and it was only put to an end in 1941. There was a general outcry amongst the German people that this was happening. It was mostly happening to people with mental health issues, but also people with Down syndrome and so forth. But the purpose there was to make the German people healthier. Same logic was applied to the Jewish people, who they said were mixing their races and weakening the German genome, if you will, collectively. All of that was done for eugenics. In our day, it's done to preserve the system of health. It's not there to preserve life, because this word dignity begs the question of what is a human and what do we mean by dignity. And there is no definition of the human that we can see in our contemporaries right now. So, I'll show you this in two ways. One, if you want to define something, you have to define its features there, what a human being is. If you decide that it's the medical profession that determines when life begins and when it ends, and you do this at the beginning and the end of life, and you allow abortion on the one hand and euthanasia on the other, you've defined the thing in the middle as well. And what you've done is submit human nature to the power of the scientific establishment. That's what's happening right now. If you go to the next slide, just today, that is really small. There's a Canadian woman was killed by euthanasia after her spouse requested it for her. She didn't want it, he requested it for her. Next slide. Same day. Man, 26, euthanized because he was diabetic and blind. He did request it, but he had mental health issues. He tried to get it before, and his mother intervened. But today, he finally succeeded in this, and his mother was outraged. His mental health was up and down, but mental health was the reason that he took his own life, and it was considered a compassionate killing. I say that because the legislation that we currently have, and Daniel spoke of one statistic, which is the sheer numbers, and Canada leads the world in euthanasia right now. In 2027, this is going to be extended to everyone with mental health. They will have the dignity of taking their own lives. Now, anyone who knows people with depression will know that this is always something that will be contemplated. And if it's not only the case that they can request it, but their loved ones and their doctors, out of dignity and compassion, can do that on their behalf. Where does that end? So that's my angle, my frame. I'll stop with that.
All right, thank you very much. Dr. Thompson, as a grief counselor, do you find that the grief process of losing someone naturally differs from if their death had been induced?
Thanks, Maddie. I have to say I'm impressed by your eyesight. He's reading off the screen. That's impressive. Can you hear me?
It's a little low. Is there a green light?
Yes? All right. Try that. A little better? Okay. Thank you, Maddie. Yeah, I think I want to start with two things. First of all, just a sense of humility, of really not knowing so many answers to these huge questions. And even though this has been a conversation and a topic for many years, I feel as though there's been a sense of this like ramped up really quickly. So I remember my first conversation was about a year ago with somebody, and it really felt out of the blue. And so I'm kind of coming at this like, I know it's been there, but it has felt shocking. It has felt jarring. And I really have to admit a sense of I don't know a lot. And so I do frame almost like all of my work as coming to individuals with this sense of compassionate curiosity. What has brought them to this place? What are they experiencing? And although I think a big part of this conversation is about a moral objective truth, I think there is still a subjective experience of an element of life. And so to think of like, okay, what has brought this person to this place and how they're experiencing something. So to your point, how does somebody experience a loss if it is by MAiD or another cause? There's many factors that will influence how we experience a loss, whether it's the role of that individual, how their role in the family, what they meant to us, the strength of the attachment. So there are many things that will influence how an individual experiences a loss. But in regards to MAiD, I think that the idea of where we are placing value in the human life adds another element of complication. And I think another element of this is the idea of a spectrum of care. So if we're saying, you know, MAiD is actively pursuing death, the things that come before that, how are we understanding that? What value are we giving to hospice, to palliative care, to even harm reduction? Right, so there's many elements that we are having to think about as far as it pertains to how loss impacts an individual beyond like the act of MAiD itself.
All right, thank you. Moving on to Mr. Dorman. I know the issue regarding MAiD has been a very politically charged one. From a political standpoint, how would you say the issue has been characterized by both the general public as well as from a more governmental standpoint?
Yeah, thanks. That's a very good question. I do think that it's been somewhat polarizing. I actually think it's a lot less polarizing than people may realize. I think there's been some really sort of almost deceptive polling done. For an example of what I mean by that, you know, if you ask somebody the question, you know, should doctors offer the full spectrum of the standard of care for an individual or leave them in intolerable suffering, the answer that you'll get back from a massive majority of people is, well, obviously they should be offered the standard of care. Now, as part of the Ontario Medical Association standard of care, you now have that there is a need in some circumstances to offer people MAiD. So there are activist groups that will take that and run with it and say, you know, a massive majority of Canadians are for this and want this. When better polling is done, that more accurately asks, you know, questions like, do you think that somebody who just doesn't have adequate housing and is maybe suffers from a disability of some kind, do you think that, you know, it's reasonable in that case for that person to be offered medical assistance in dying, or and you know, using the euphemism MAiD. and a majority of Canadians say, well, no, of course not. We want people to be cared for. We want there to be palliative care. We want people to be offered a true spectrum of healthcare, not suicide. But if I could step back to just a little bit, I think it's really important in approaching the discussion of MAiD, certainly to bring in some of the broader ethics, the broader trajectory of the West over many decades that has led us to a point where human beings are considered, that you can discard human beings, that the value of life has just been diminished so much. I think that's a really important discussion. I also think that it's important to understand its political trajectory in Canada over the last 10 years, because I think it almost provides a horrifying test case for how unjust laws come into being. And what I mean by that is two things. First, MAiD came about. It became legal for a doctor to provide assisted suicide to people through two things. First, they convinced people to call it MAiD. That is, they wrapped what is in the truth, what was a change to Canada's criminal code, and it was a change to the criminal code on the section on culpable homicide. And they convinced what, accurate language for what's gone on in the last 10 years would be something along the lines of, increasing exemptions for medical practitioners to commit culpable homicide. And so that's where the debate should be. It should be about that. Instead, it became about, assisted suicide and then euthanasia and then MAiD as this sort of euphemism that covers the reality of what's being discussed. And certainly if you read your George Orwell, Politics in the English Language, I think this is a great example of sheer cloudy vagueness defending the indefensible, because I do think the reality itself is indefensible. So they convinced us to call it MAiD, and then secondly, they skirted democracy. And this is a more complex one to understand. It requires some Canadian political history to wrap your mind around, but I'll try to give that really quickly. In 1982, of course, many people will know that that's when Canada got the Charter of Rights and Freedoms. The Charter of Rights and Freedoms, I think in and of itself, has a lot of very good things in it. It, like much or some of the human rights movements of the 20th century, grounded itself intentionally, explicitly in Christian principles, the value of the individual, the value of life. But what happened when a Charter of Rights and Freedoms was added to the Canadian Constitution is it, in some ways, took power directly out of the hands of the elected legislature, directly out of the hands of the democratically elected members of Parliament responsible for our legislation, for our laws, and it put it in the hands of 9 super lawyers. Like think about what the Supreme Court is. It's these sort of people that we've deemed as super lawyers, but they're not elected, and they have their own political bent. And so what we've seen increasingly, maybe not right in 1982, but people raised the concern then. What we've seen in recent years, in the last decade in particular, is an increasingly activist judiciary that decides that it is going to write the laws or remake the laws of Canada as opposed to the democratically elected parliament. And that's exactly what happened when MAiD became legal. It was a case that went to the Supreme Court, and where the Supreme Court told the elected body, you must rewrite the criminal code because it violates the charter. So they convinced us to call it MAiD, and they got around democracy. So, and I think, again, just the broader point of that where you see an abuse of power, where you see a political injustice, look for where the language was abused to get you there, because it's a sad reality when what should be talked about as assisted suicide or culpable homicide ends up being discussed as MAiD. And maybe I'll keep going just for 1 second since I have the mic. There's also a really important distinction between when MAiD came in 2016. When it first became legal, it was exclusively what we now call Track 1. And track 1 was when death was supposed to be reasonably foreseeable. As in, it was supposed to be provided to people, that people would be killed when they were very near to death. That was the justification given. Now, that was already extremely problematic because there was no enshrined medical or legal definition of reasonably foreseeable death. I mean, arguably, my death is reasonably foreseeable, and so is everyone's in this room. So it was, again, sheer cloudy vagueness covering up, giving space to a system that could be abused, and it's been very significantly abused. I'll get back to that in a second. The second is track 2, which is when I was working as a legislative assistant to a member of parliament, the House of Commons was debating whether to expand the eligibility for medical assistance in dying for euthanasia to those who are not, whose death is not reasonably foreseeable, but for whom their suffering is deemed in some way intolerable. And again, as Dr. Masson mentioned, this expansion is quite possibly continuing in 2027 to where mental health would be the sole cause of that suffering. And I think quite horrifyingly, there is documented record of Parliament considering MAiD for minors as well. So the scenario that could become a reality in Canada within a few years' time is a depressed 15-year-old after high school having a discussion with a doctor who may even be required to raise MAiD as an option. And I know that sounds almost fantastic. It sounds almost like a conspiracy theory, but it's there in the records of what's been debated in Parliament and what's been testified upon. And to get back even just briefly to the eugenics point, the UN Special Rapporteur for Peoples with Disabilities has chastised Canada, I think, 2 or 3 times for our euthanasia regime. Precisely recognizing that, especially as we've given access, we've expanded eligibility for MAiD to people that are not dying, that there is a system ripe for abuse, particularly of disabled people. And again, it sounds tragic and fantastic and almost unreal, but I know a young woman in Ottawa who's in a wheelchair. She has a disability. She got pneumonia, went to the hospital not knowing what she had, but needing emergency care, and was offered euthanasia at the hospital. And so I think that again, it's anecdotal, but it's rather terrifying to think, and I think most doctors in Canada would also find that rather horrifying, for the record. But that, the reality is that is built into our system in Canada at this point. Yeah, so I'll leave it at I'll leave it there. Thanks.
All right. Thank you very much. Okay. We will move on to Dr. Masson now. I understand you have experience serving as a pastor previously. How would you approach the issue of medical assistance in death, specifically from a pastoral perspective?
Well, that was 10 years ago now, and this scenario didn't exist at that time. It would have been unthinkable 10 years ago. So one of the things I've observed, and this is people complain about older people saying the way things were in the good old days. Francis Schaeffer, as I said, in 1984, is already complaining about a growing culture of death, which evangelicals were not speaking out against, by the way. And at the time, it was only Catholics that were speaking against abortion, and he could see this as a thin end of a wedge and did not see any particularly Christian defense of human life and dignity being advanced by the right. And so he thought, and I think this myself, that the terms are basically meaningless. And what we have instead really is a battle, as it were, between the transhumanists and the posthumanists. The transhumanists want to augment our life. They get a lot of publicity because their billionaires are behind it in Silicon Valley. And we all have cell phones, so transhumanism gets the airtime. Posthumanism, just thinks that that this idea, this concept of human nature has no intrinsic worth at all. It's as useful as an inanimate object. So my cell phone has as much dignity as I do from that perspective. And to add to the problem, I produce carbon. And carbon is seen as a threat to life. So now we have human life being pitted against life against life. And one threatens the other, and to save the planet, we're going to have to deal with the other problem. So there's a legitimization of reducing the harm of humanity on the environment built in the whole scientific establishment. I'll give you 2 illustrations of this. I could give you dozens. One is that the scientific journals, which we trust for our information and for our science, a few years back were bought out by a conglomerate called Clarivate, whose chief aim, and you read it on the website, is to fight climate change. This is its chief aim. Now, this is a scientific publishing conglomerate overseeing a whole wide swath of journals in different scientific fields. But something over 95% of the journals are owned by this one consortium, and its chief purpose is to fight climate change. Now, you might just say that that's woke sloganeering, it's just virtue signaling. I take it literally, and I think it's more serious than that. And I think there's a thumb on the scales of how research gets funded, and the funding comes from bodies and scientists that will say the right things and advance the right causes. Even if some of them don't mean it, that's where the funding comes from. And as we know, in recent times, a lot of scientific papers now, over 70%, cannot be replicated, which basically means they're fraudulent. They're not scientific at all. So a huge problem with the credibility of the scientific establishment in even telling us that something is true or false. So there's an integrity issue on the issue even of scientists, never mind weighing on the ethical issues here, but just deciding whether they're doing things that would fit the usual notions of truth and falsehood. So to Daniel Dorman's point here, the politics of the English language comes in full force. And I'll give you another way in which this has played itself out, and that is in the oath that doctors now take. It's called the Hippocratic Oath. Who's heard of the Hippocratic Oath? Everybody. Would you believe me if I told you that the Hippocratic Oath has been changed? This was revealed to me over a decade ago by a good friend of mine. It used to have as its first principle for all doctors, because if you're a doctor, you realize that the person in front of you is very vulnerable, and you are going to use the best of your abilities and the best knowledge that you have to help this person. But at the end of the day, there are things beyond your abilities, and you're taking risks, and you have to be careful what you do. And so the first thing that they say in the Hippocratic Oath is an ethical obligation is to first do no harm. Because in trying to cure the patient, you might kill the patient. Well, lo and behold, they removed that line. The doctors that now swear a Hippocratic Oath to take care of us no longer swear to first do no harm. I think that that is telling. This is not to say that the people who become doctors are bad people, but it no longer occurs to them that not harming is part of healthcare. If you can kill in the name of healing, what's the difference between a murderer and a medic? Where is the definitional difference? Where is that line? Because I just see fog, and in the fog of definitions, the fog of war on human nature is advancing. So my final point here, in relation to that article I saw today, the fastest growing category of Canada's assisted dying is not those with terminal illness, but those labeled other. Son Gained, a University of Toronto psychiatry professor, told the Free Press that MAiD deaths registered in the other category in Canada nearly doubled between 2022 and 2023 to 4,225. They doubled in 1 year. And the other will then be those that really have nothing to do with balancing autonomy and protection. They will slip into the area of mental health. And as I say, in 2027, the shackles are off entirely on that. So I think it's already happening, and it will continue to do so. And we have not had, despite what is said, this is not a controversial topic. There's no public debate on it. It ought to be an election issue. It will, I guarantee you, it will not come up in the next federal election, because the Conservatives won't want to fight on that front. And the Liberals will not want to talk about that either. They're going to talk about something else. But in the meantime, it is the human rights issue of our day, in Canada at any rate.
Maybe I could just jump in on a couple pieces there as well in terms of that just cloudy vagueness. I forgot to mention, I should have mentioned that when the Supreme Court struck down, said that our criminal law was invalid, that it was against the Constitution, the section of the Charter of Rights and Freedoms that they did that with was Section 7, which is the right to life, liberty, and security of the person. So the courts found the right to euthanasia in the right to life, liberty, and security of the person. Now that sounds like the beginning of a bad joke. It sounds obviously and explicitly contradictory, unless you, I guess, hold an extremely radical definition of liberty. But I don't think any of us, we don't go to Niagara Falls and look at the guardrails and think, well, that's affronting my liberty. But that's more or less what the Supreme Court ruled on. But to jump off of the point of how pastors ought to take this, and I think it's relevant to what you were saying in terms of the other category, because we know that track one, that is those whose life is their death is supposed to be reasonably foreseeable, because we know that track is very abused, and there's a lot of actual data on this. Thankfully, the Ontario coroner has now what they call the MAiD Death Review Committee, and it's actually trying to study and put some statistics out about this, which I'm grateful for. But we know that there's huge abuses in the system of people that they don't really qualify, but we'll move them to this track. We'll find a way, and of course, all in the name of compassion. But again, so if a lot of people, a large number of people that are approaching MAiD are not eligible, what you're looking at is people who are suffering and suicidal. And I think that if you ask the same question and say, well, yeah, they're using MAiD as the means of their suicide, but in many cases the pastoral care should take the form of the exact same way that a pastor would approach somebody with suicidal ideation or suicidal thoughts. There may be rare cases of however you'd put it, true track one people where they are truly approaching death, and I still think that there's something to be said there in terms of asking people about how they want to spend the last moments of their life, and certainly for Christians, whether they want to supplant God's timing in ending their own life. But it's a very, I think for many, if not most at this point, the question is, well, this person is suicidal, and that's the pastoral care that they need.
I wondered if I could actually direct back at Dr. Masson. Just in light of Maddie's question about pastoral care, I was wondering your take on a theology of suffering, because I think we are not equipped to handle suffering. And what that means in our culture is expanding too, right? Even this idea of we hide aging, we hide any sort of pain. And I think that is a critical part of this, is how do we, it's decorative dignity, right? You drool and you don't produce and you don't buy. Therefore, you don't have dignity. So I'm back at you about the pastoral part. I wonder your theology of suffering.
Yes, okay, thank you. Well, suffering does not render us inhuman or subhuman, because the Lord of life himself suffered. And his suffering had meaning and purpose, which when you're dealing on a pastoral level, I'll give you a couple anecdotes that occurred to me. I didn't mean to duck the question, actually. I just thought immediately, I didn't deal with this. But I did deal regularly with people who had mental health issues, including schizophrenia. I remember 2 men. And if you don't know, schizophrenics really don't have a good grasp of reality. And there is a sense that everybody's out to get them. Or not everybody, but somebody. Or it's usually the government, there's voices, they hear things, and there's somebody after them, and they have to do something to deal with that, and they can do terrible things. And sometimes there's an awareness on that. One of my good friends from church 20 years ago was schizophrenic, and she was afraid that, she told me she was schizophrenic, my wife and I, and was afraid of herself because the voices, and she couldn't differentiate them. And it's a little bit scary for the people that the person's with as well, because it's very easy for that person to think that actually you're the person that's out to get them. And there's no way you can dissuade them from that if they're convinced that that's the case, and they'll do anything out of fear to protect themselves. So I knew a number of people in that situation. If they'd had this option, if they had not taken it upon themselves, I'm sure some good psychiatrist, and you'd find one, who had a theology of suffering that was non-existent, as in they thought this is unbearable. You'd find somebody that would help that person end their life. Now that's an extreme case, schizophrenia. There are many mental health conditions less acute than that. I had a friend who worked in a hospice, and he said that in terms of the pain that people imagine being an unbearable agony at the end of their life, and that's what they want protection from. That unbearable agony they imagine themselves experiencing, that's what they don't want to go through. And that's why the MAiD legislation, that's the scenario. It's all about framing. This is the thing that people want to avoid. He told me that with the pain management medication that they have, that there is no scenario where people are experiencing that sort of pain that they can't manage it. They can die with dignity already, they just manage the pain. It doesn't mean they experience no pain, but it does mean that the pain is not something that can be dealt with, at least in the hospice. That was his experience. Again, it's anecdotal, but it's the anecdote of somebody who was looking after people that came in there. That's why they came there. They came there to end their lives with dignity, but being looked after to the end of their days by somebody that cared for them, who held their hand, who prayed for them, who treated them like a human being, treated them with love and compassion. That's what people want. They don't want to be a burden on their families. There's some issues there. There are family issues, the broken families. These are downstream effects of all sorts of social ills. But we're taking care of the ills by creating more harm, and creating more harm doesn't deal with the damage, it just intensifies the damage. So that's, as a pastor, I would have said, I absolutely have to comfort you in every way I can. So I met up with these guys. They came to me because they actually seek out pastors often. They come into churches, they walk in, and they want somebody who's going to look after them because it's not their family. Their family has usually disowned them at this point. And they're just desperate. And that's who they go to. And so I had all sorts of, and I've heard other pastors say the exact same thing. People come to them, and they hope for time and care. And it takes a fair bit of time and care. I was a college and career pastor. I end up these are guys that come in off the street. I think that scenarios change very much now. One final thing. Schizophrenia is induced in something like 10 to 15% of the population through marijuana. What's happened since 2015? Legalization, pot shops everywhere. What's going to happen as a result of that? If you are susceptible to it, you can do it once and be schizophrenic. I have friends from high school who are schizophrenic from it. So that's going to intensify. So again, drug policy, health policy, family policy, medical redefining, legal definition, they're all being calibrated in the same direction. Doesn't matter if you're liberals or conservatives, there isn't really a defense there. So I say there isn't a political, it's not a political issue in the sense that it's actually being discussed by politicians. There's a sense of helplessness even amongst the politicians on this, in fact. They feel like they should do something, they have to do something, because look, and Canada is becoming the canary in the coal mine for the rest of the world. People are looking on with horror. Canadians don't even know it because they can't see the news on social media because it's been blocked by the government. Out of a, quibble with a social media company over money. Is it really about the money? I don't know. Anyway.
All right. Thank you very much. A couple more questions, and then we'll start to wrap up for the evening, I think. I will turn to Dr. Thompson. How have you seen MAiD or even just end-of-life relatives passing away impact families and children in your practice?
In any specific sense? Like, can you?
It's a little bit of an open-ended question, but yeah, how has MAiD or general end-of-life care for loved ones, that sort of thing, how does it tend to impact their loved ones and those around them?
End of life care. Okay. Yeah, I think actually end of life care, and again that idea of if there is a spectrum, like what happens between like palliative to hospice, really does impact families. The availability of care can be hugely impactful. So many people have had incredible stories of hospices. The ability to care, to give space, to die well, has been transformative to so many people. And so I think sort of adjacent to what we've been talking about today, the ability to provide that as an option before MAiD is going to be something that absolutely needs to be talked about more. MAiD is becoming like a go-to before these things. And I think this even, again, this can be broadened out to so many areas, but even the idea of harm reduction, where does this fit in to the conversation, right? What care is there for individuals, right? If we're talking about the opportunities to meet people in their pain, and we don't want to get to this point of MAiD being an option, what do we have to do to back up? So to your point, yes, the availability of care, the options of care at the end of life have been really significant for families, especially with kiddos. We know that knowledge is power for kids. So to have adults who care, who have the time to sit with, who are able to provide answers to questions in developmentally appropriate bite-sized pieces is so critical. Like, what happens when you die? Your body stops working. How come, right? So like the presence, the time, the patience to be with kids. And innately, death does not traumatize a kid, right? Traumatic death could be something different, but being exposed to conversations, being exposed to loved ones is not traumatizing. So the ability to, be present and have conversations is really, really critical. So again, turning our attention to what is happening at the end of life to give space and value to pain. And again, I think we are turning such a blind eye to what happens in those critical moments. And again, this idea of dignity, that are we saying that there is no dignity in the simple breath in our lungs? And I think that that's a significant issue.
If I could just jump in as well. Just a few weeks ago, I was having a conversation about MAiD policy with a physician, and I was kind of saying, well, I really hope and believe that people aren't advocating for MAiD, for euthanasia, because of of challenges in our healthcare system. Canada's healthcare system in total is, I mean, struggling is putting it very mildly. Canada now spends something like 18%, you know, pretty close to a fifth of our gross domestic product. Our total productivity as a nation goes into healthcare. That's only gonna, we have an aging population, that's only going to go up and up. There are countries in the world, Japan being one example, that spend half of what we do in terms of GDP percentage on healthcare. Their systems offer much more effective healthcare. So there are ways in which we need to be better on that front. But I said to the doctor, this family physician I was talking to, I said, I hope people aren't advocating for it. You know, the optimistic side of me wanted to believe that it hadn't become so crass as a dollars and cents consideration. And what she responded was, well, actually, I work with a MAiD assessor, a sort of MAiD activist doctor who does see MAiD as a solution to costs of our healthcare system and to our lack of palliative care beds and our lack of hospice care. And so, I mean, that still shocks me, and I don't think that that's representative. I think that that person has probably spent a lot of time with, is it Skinner? You know, PFC, or you know, the runoff ideas, the cultural runoff of those very scary and I think terrible ideas. But yeah, I mean, I do think that there needs to be, and actually, as far as where Christians could be involved in this, you know, advocacy for proper hospice care and proper end-of-life care, which should, as has been said, be able to manage pain well and offer people a genuinely dignified situation to die in, scenario to die in. So yeah.
All right, thank you all so much. Are there any final closing thoughts before we take a brief break?
And then there'll be Q&A.
Will there be opportunity for a remark after that, or is this a good spot? Sure, I'll save. Well, I have one thought, but I'll save it. Thanks.
All right, thank you all so much. We're going to break for a brief recess, and then we'll come back for some Q&A. So if you have any questions, maybe write them down, think about them a little bit, and then we'll come back and you'll have an opportunity to ask our panelists. Thank you so much.
Oh, fully. sure that even informed consent now is really all that informed.
No, it's not. So that was a, I totally agree. So but that's just, you know, how much do they do it? And the problem is we have to, there has to be 2 doctors or 3 doctors, and you have to say this, whatever. And there's so then the lawyers get it. What is informed consent actually? But the point is that their own firewall of medical ethics, which is there even in psychology, you can't do a survey without somebody checking the box and saying,
Yeah.
I agree that I'm going to fill in
Oh.
the survey for the purposes of a psychology.
The way you ask it
The
and
way you
state
ask
it is like,
Yeah.
you can skirt that in 2 seconds.
Everybody knows
Yeah.
from stats that you can manipulate anything. You can talk about it in terms of polls. It's how you frame the question, who you ask it to, all that sort of stuff. And then they present it as, so here are the stats that show the overwhelming support for what we're doing. And, but again, when they really want to rush things, then informed consent went. COVID, I still think we're living in COVID. COVID's connected to this as well.
100%. 100%.
100%, right? In a strange way.
Well, I think it amplified all of the gaps and the pain points we have,
Yes.
right? So
Yes.
the areas that we weren't yet feeling, we're just like, oh, there it is. Like, there's where we are missing care. There's our anxious
Yes.
spot. There's where, yeah, and I think that's just like we just skipped ahead where it would be.
We're not going fast enough. Let's speed things up. You know why? Agenda 2030. UN 2030.
Oh,
It's
yeah,
got they're net zero. We got to reach this by 2030. We're never going to reach that in a million years. We're not even moving towards it. Well, how do we get there? We're going to get there by hook or by crook. Here's how we're going to get there.
think we should be ready to reconvene. Now, I have a couple of questions from online, so I'll begin with those, and then we can go to audience questions. All right. So as Christians, should we not desire to alleviate pain and suffering, and to that end, find MAiD a preferred alternative to leaving someone to suffer for a long time before they die, particularly if the party in question is already a Christian? And that's open to anyone that would like to take it.
I can start off, and perhaps others jump in too, but Ian Gentles, so a longtime Tyndale professor, did write a book on euthanasia MAiD right as it was becoming legal, and one of the arguments presented in that is that it really is, it's just false. I mean, certainly with the, perhaps this wasn't always the case, but with modern medicine as it is, that there is ways to manage pain. That's not to say that there would be no discomfort at all, but that there is very real options in hospice care. But I do think it comes back to that broader question of the theology of suffering and the value of the breath in our lungs and the dignity of God's breath in us. And I think that well, I was going to save this, but I'll read it here. I have a lot of professional connection to MAiD policy, to the legal questions around it, to some of the ethical considerations, and certainly have tried to approach that as a Christian and understand it. But my father-in-law, 5 years ago now, was diagnosed with ALS. ALS, for those that don't know, being a neurological disorder that slowly paralyzes your whole body, leaves your mind intact, your body goes. And it's actually the disease, it's the case that went to the Supreme Court that was the initial impetus for MAiD to become legal in Canada was an ALS patient. And so my father-in-law is entirely paralyzed. He can blink and sort of move his eyelids. And thanks to technology, he can type with what's called eye gaze technology. So it's an iPad with a camera. It tracks the movements of his eyes, and he's able to communicate that way. And it's beautiful. But rather than speak for him, this is something he actually posted on Facebook, and I'll read it because I hope it gets to the question pretty explicitly. This is my father-in-law, Philip Serez, speaking. I just learned of yet another person who has chosen MAiD. If you aren't Canadian, that is our term for medical assistance in dying. It's freely available here. I want to be sensitive to those who have chosen or are affected by MAiD. It's complicated, it's personal, it feels private, etc. It has become a common narrative for us in our medical story, that is, for those with ALS. My neurologist said that of her hundreds of patients, I am the only one still alive at this stage of progression and in my age category. Please allow me to provide an alternative narrative. I have spoken a lot of the silver linings in the storms of suffering, namely the richness of authentic relationship, generous community, and spiritual healing and wholeness. There is so much to discover on the other side of loss, yet so many decide the losses are insurmountable and give up on life, and the many blessings that could be theirs. People I have come to know have ended their lives for a whole bunch of reasons: physical limitations, loss of dignity, deep discouragement with future prognosis, grief over the life they knew and lost. I empathize with those in chronic pain or those who have no family to surround them. I am surprised when I hear of those with loving community, presuming the burden they pose must be alleviated. So he's talking about one of the key causes for MAiD, and we know this in the data now, is that people feel they're a burden to those around them, and that's why they choose MAiD. So he's surprised to hear that people feel that they need to alleviate the burden of those around them with the most drastic measures. This is my father-in-law, Philip, again. Me, I have traded my legs for friendship with my kids, have traded my hands for many more of family and friends. I have traded my privacy for a deeper, more tender community. I have traded my independence for the loving care and provision of God the Father. Yeah, the first year was traumatic. I feel like I was going through PTSD. If I had made a life-ending decision during those lows, I would have forfeited so much and robbed my community of the same. That's just my story, but it's real and hopefully can be for others as well. My father-in-law's name is Philip. My eldest son, his name is Philip. I have a second son as well, Ethan. My father-in-law just would not know either of his grandsons if he had chosen MAiD, nor would he have had years of experience of abiding in God's love and in God's peace, and of really being able to witness to the power of God in his life, to the peace he experiences in Christ, despite losing, he can move his eyelids, that's it. So, yeah.
Thank you very much.
Could I just say, so that's his perspective. I can't speak for your children, but the children see that their grandfather is of such worth to their parents that they're going to put themselves out and they'll see this as normal. And how much will that change their world, and how much then will they change the world with such people? Because I talked about human nature, definitions, we talked about suffering as an aspect of the theology of suffering. If you will include suffering within your humanity and will show that it doesn't, we don't have to be afraid of it, but we lean into it, as it were, then it really changes the people around you. And it will, like, that story is just, I thought immediately of my own children, and that's what the effect would be. You have to imagine it, of course, but those stories need to be told. That's a great story. Thank you for that.
Thank you very much. The other question that we have online here, the issue of MAiD makes one think of The Giver by Lois Lowry, wherein they release the elderly via lethal injection when it is simply their time to die. Is there concern with MAiD being used when it's not essential or needed? And what implications could that have for our society if we started treating MAiD in such a way? We talked about this a little bit already, but if there's any further comments you'd like to make on it, you're welcome to.
Necessary, legal, advisable, practical. These are the tyrant's excuses for tyranny. And they're always used to justify things that cannot be justified. And so we've had to change the language just to reframe the debate to make it about compassion, and people will sense the compassion. They feel, most people are moved by their feelings. Yeah, everybody knows this. There's only a very small percentage of the population that isn't motivated primarily by their feelings, even. And so if you want to, in a democracy, if you want to win a debate, you appeal to the feelings of the audience. And what do the audience feel? Well, the audience feels that they would not want to be a burden on their families, in intolerable suffering, in a situation where the healthcare system wasn't going to look after them. And there are all sorts of practical concerns here, and I think they're legitimate from a subjective perspective. But that is a slippery slope that literally there is no bottom to it either, and it just speeds up. And again, I say that the situation of other that was cited as the growth industry in the euthanasia, number of people being euthanized, it grows amongst those who don't have any sort of physical or mental health condition. It's just like nothing that would be mortal. There's no mortality being envisaged. And that is just growing, and it's going to keep on growing, I would predict. Because once you've got rid of those people who are actually terminally ill, and they'll come up every year, of course, because that's the quintessential human statistic. Everyone born dies. It's, perfect statistics except for one. So that's coming, and it's going to come every year because people will die. But how many more will be expedited on? And so we were talking about ourselves. I don't know if you want to go to this or not, but we were talking about the financial aspect of this. And we did talk about that before, but And I said, and I thought it bore repeating, that medical doctors as a type of person are highly driven individuals. To get into med school, you have to have really high grades. And you have to be a certain type of personality, because it's not enough to get high grades. You have to really drive yourself, and you have to say, I'm not going to do these things I want to do. I got to sit here and I'm going to study and whatever. And you get it. So it's like the A type of personality, in addition to being, hopefully, people who are compassionate, want to help others and so forth. There's a certain prestige and drivenness that goes with that type. And those types of people don't like what they do to fail. They're used to success, they want to succeed, and if they see the medical system is getting swamped by people who are in need of a lot of care, and it costs a lot of money to take care of them, they find that the system then, because there's in a closed healthcare system like ours, public health means rationed healthcare. Everyone gets a ration. And if most of the rations are being taken up by people who are in a lot of pain and suffering, then there'll be smaller rations, fewer rations for the rest of us. There'll be longer wait times. You won't be able to get much from that, but that's all you're going to get. There's no more unless there's more money that goes in. But you could pour more money in, and the number of people that are going to... So the doctors are going to say, driven by their sense of desire to help those other people, we got to get rid of this group. Because they're dying anyway. We know they're going to die. Like, what's the difference? If they want it... So I think the medical profession, just by its desire to control the outcomes and to preserve the system, is pushed into this position. Not just that one doctor, but I think it's a sort of a type there. And it's not because they're bad people, it's because they're sinners. And they want to preserve the system, and they want to do good things for everyone. And they can't save it. So it's a real problem. And the way you safeguard against it is you don't allow for it at all. Doctors are not allowed to kill. Full stop. There's no, that's the absolute, there's no allowance for culpable homicide in the healthcare system. But once that gate's open, it just grows larger and larger. Yeah, anyway.
All right, it looks like that's all we have for online questions. We'll now open it up for those in the audience. I'm going to be coming around with the mic. If you have a question, just kind of indicate to me, and I'll come over you, and you can ask it directly to our panelists.
I do think very much recently, I think one of the articles Dr. Masson cited was in the Free Press, so a very large, the largest Substack in the world, but a very large American publication. When I was, a few years ago, there was a vote in the House of Commons. It was about whether to extend MAiD to those with mental illness. And the result of that vote was to put off the decision until 2027, as has been said. But there was a very sensible motion put forward that basically just said those in suffering that have suicidal ideation should be given compassionate care and told that they're valuable. I mean, that's my layman summary of it, but that's what the motion said. And at the time, it was something that the majority of Canadians supported. And that's, again, some of that better polling that's out there. And it didn't go through. And I think that shocked a lot of certainly Americans who by and large do not have, it's more state-based, but they by and large do not have access to euthanasia in the US. But even some European nations, Belgium and the Netherlands, that have had euthanasia for longer than Canada, and at one point in time, certainly when it was becoming legal, were looked at as, well, we shouldn't open the floodgate to this because it will end up looking like Belgium or the Netherlands, and I think we've only ended up looking much worse. I think Americans are, I know that Americans are noticing. I wrote for a major U.S. publication, the National Review, on this, and then was asked to speak on a number of radio and a couple television shows about it at the time a few years ago. And the questions from Americans were, shock and horror. Just shock and horror that Canada's system was considering that there was this sense of dollars and cents consideration in it, that there was expansion to people who weren't otherwise dying, that their death was not reasonably foreseeable, and that is now part of our legislation. So yeah, I think Canada is the worst on this right now, and that, I think there's even possibility that international pressure, just from places in the world that haven't quite gone down this road, this technocratic road, and acceptance that human life is invaluable, will actually push Canadians back towards, will contain MAiD in Canada to some degree. Maybe that's overly optimistic too.
This question's open to anybody. In your opinion, is the offering of MAiD specifically to Canadian veterans a symptom or a cause of degeneration in regard to our society's valuation of respect and sacrifice?
So the question is related to veterans, which it is being offered, I understand, to quite a few. I've known, I have friends who are vets, and also access to enough people who know vets. So for their trauma from the war, they're often offered marijuana. Now they're being offered MAiD. Both of them. And what's the specific question again related to this?
Is it a symptom or a cause of degeneration in regard to our society's valuation of respect and sacrifice?
It's both. So it's a symptom of the lack of value that we place on human life. And at the same time, it's a cause. And this is a funny thing, because we want to create cause and effects here. But once you open the door to things and it becomes permissible, and you tie that into a medical system which is supposed to manage it, like I said, in a totalizing fashion. And it's really funny that in Canada, where the reason why you don't have private health care like they do in the US is because we don't want those scenarios where dollars and cents decides human dignity. We're not like the Americans. And yet, that's exactly what is happening in Canada. And that is one of the chief drivers of this, I think, is the cost. And you could say reform the system. And Daniel spoke about how much more efficient other countries are in their healthcare. France, Germany, Japan. Some who have combined a private and public healthcare system, like France and Germany. And so they didn't, it didn't mean, selling out or the rich getting good medical care and the poor getting, nothing, which is the way it's presented in Canada. But I think it's both a cause and a symptom. So at first it's a symptom of the lack of value that we place on human beings in general in Canada. And abortion was just the spear tip of that whole thing, because the most vulnerable, the most dependent in the sanctity of the mother's body are being assaulted there. Not even when they emerge. We're not waiting to expose them to the elements like the Roman pagans. We're getting them before then. Before we can see them, we say, well, this is just a clump of cells and all that sort of stuff, which has now been blown apart by medical science. This is not a clump of cells, as a human being. But once you open that door, so there's the symptom of a lack of regard for human life. And then it causes all sorts of cascading effects in other areas where it's a burden on us. We don't want it. Just like, you know, the pregnancy. I didn't want to have the child, and every child should be a wanted child, and all the language that goes around. You know, a woman who gets pregnant doesn't want the child and shouldn't have to carry the burden of et cetera, et cetera. So the same language comes in. And then euthanasia is, again, part of eugenics, but eugenics isn't just including having beautiful babies that are, you know, like Superman and run around and are capable. It also extends to a comfortable lifestyle that I envisage for myself. That's part of my eugenics, is not just my human being, but my human community around me. A certain amount of wealth, I want to be able to do certain things. Lifestyle, in other words. So it causes that, and it confronts our culture of, well, we're really utilitarians in our ethics, but we're also, I think, hedonists. And the boomers, more than any, have modeled hedonism, and they're going to hold on to that to their dying days. I'm going to go out enjoying my life, because that's what I'm entitled to. Life is about enjoyment, and I'm going to enjoy it to the end. And when I stop enjoying it, then I'm going to end it, and I'm going to do that. And Canadian Association of Retired Persons, CARP, they're full on behind this. Like the seniors organization, the biggest seniors organization, they're behind this legislation. And they're the ones that most resist the idea of private health care as well. So they tend to be left-leaning. I don't want to make this a political issue, because as I've said, it's not a political issue, but there is that dynamic to it. It's really odd. Anyway. But yes, it's being pushed to veterans in particular, and I wonder why that is. But it is a dynamic that's there for sure. Yeah, Canadians don't deal with their veterans well at all. Terribly. I don't think it's good in many countries. Even the US, it's not great either. But here it's appalling how we treat our vets.
Yeah, that's a good question. As a registered psychotherapist, we aren't able to do that. That would definitely be crossing an ethical line to persuade or to even put in any sort of religious, spiritual, persuasion even, or advice. So yes, we wouldn't be allowed to do that. I feel as though the way we hold space and the way we can ask questions can be, even if we're not explicitly bringing our faith into the room, I absolutely believe that the way that we hold and ask questions can be so powerful. So as Christians who are therapists, even if we aren't explicitly allowed to say something, I really have challenged students in my classes to say, okay, like, how can we take this step back and again, be just genuinely compassionately curious about what has brought this individual here, and thinking of even all of the things that we've talked about that has led to this moment in our cultural context to be having these conversations. How can we hold space for the fact this person has a history behind them, has had experiences, has had family who have maybe informed why they're there. So I really think that there is so much we can do even if we're not explicitly allowed to bring that in. Yeah, but that is definitely a tension. And I think we, and this happens beyond grief counseling, is we have this in us to want to fix, right? Can I offer a solution? Can I want to fix? Well, actually, that often doesn't help at all. So to have somebody who's like wrestling with this huge decision, sometimes it just doesn't help to offer ideas or solutions, but to give the space to wrestle with, this is value, this is meaning, this is, these are huge questions. So yeah, to allow the time and the listening ear to wrestle with that, I think can be a really important.
If I could ask a follow-up question, some of the data coming out of the Ontario MAiD Death Review Committee is also collected from family members and their experience of their family members passing through MAiD, and there's a reasonable portion that, well, they were, perhaps in favor of it, perhaps not beforehand, were sought it out, or their family members sought it out, believing it would be, dignified and quick and avoid a sort of traumatic passing. But in fact, it often is, according to the data, quite traumatic. So, I think even, I just wonder if there's a place for a Christian counselor to be able to, maybe if it can't be persuasion, can you warn people that it's not going to be what it's advertised as this sort of dignified, calm passing?
Yeah, I think you can bring that into the conversation. So somebody comes in and they say, this is where they're going. Well, okay, tell me more. What are you thinking about? What feelings come up for you, right? So even to just provide space to talk through that. What are you anticipating? What's that like to think about that, right? So to give the space to have those things come up, I think is part of it. So I think even in their own discussion, and I've had this happen a few times where an individual's come in to talk about it, a family member has elected for it, and in the process of slowing down and talking things through with the therapist and myself, the family member has actually changed their mind, has put it on hold, and then actually died naturally before it happened. Right? So I think just allowing the space to ask questions in and of itself is such a powerful opportunity.
Allows people to have the space to question even what they've maybe been told about what's
Absolutely.
coming. So, yeah.
So my question on this is, so you're not allowed to discourage somebody from that option from a professional point of view. You're not allowed to counsel somebody not to do this. You're just allowed to, you're open the questions and have the conversations, but it's in terms of professional ethics, you're not allowed to have an opinion there expressed. It's not an opinion anyway, it's a sort
Like
of...
as a registered
you're supposed to
psychotherapist, I am not allowed to say, here's my opinion on this, unless they invite me into that conversation and I know my answer is actually going to be therapeutic.
Right. I think I can foresee the day, and it won't be too long before, just like on the gender issue, people who try to oppose it will be prosecuted. I'm not sure we're there yet, but it's coming. People who try and stop other people will be accused of interfering with the autonomy of the individual making this choice for themselves and influencing them away from a totally free choice.
So this is already happening.
Okay, there you go.
Very peripheral at the moment, but there is something called now rational suicide, where a client has stated, I know I cannot receive MAiD for mental health, and I know that I want to die. And there has been, this is more from actually at West, there's different views on the West Coast, but talk of, okay, what can a therapist legally do? Because right now we have a duty to report, right? I need to call, you're at risk of hurting yourself, you've told me it demeans the plan. No, you can't, because you are questioning my autonomy.
Right. Right.
Absolutely.
And I think there's a great organization for those that want to look into it further called Canadian Physicians for Life, and they've done great work on it. But one of the things that they will discuss and document is the number of doctors that have potentially left Canada, recognizing that they don't want to be part of a system where they're asked to even refer someone for euthanasia, for MAiD. And I think that, it's quite possible you'd get to the same point with therapists, psychotherapists.
I think something that I lean into with this is like, we all hate feeling out of control. And one of the biggest ways we feel out of control is when we feel pain and we don't know what's next. And I think giving space to be like, yeah, it's scary to feel out of control can be such a big part, right? I think that there's this sense of like, I feel out of control, emotions rule, so I've got to act. And that's what's so prevalent in our culture right now is I hate this, I got to do something about it, so let's go. And I think that to offer space to slow down and be like, what is it like to feel that? How are you, what is it like to feel out of control, to feel this pain? And I don't think we do a good job of holding that space. Even as Christians, we fear that too, right? So
cause and effect. Cause and effect. Trying to control everything and condition everything, the sort of the agenda, the B.F. Skinner, where we will have to get rid of freedom and dignity in order for that to happen, can be accelerated, and it can be accelerated in an experiment where we decide we're going to suspend civil liberties. We talked about this in the break. During COVID, this seemed to intensify. And I observed at the time, I was public on this as well, and got vilified for it. As you can imagine, during COVID, any resistance was roundly regarded as virtually treasonous. And some people have been prosecuted for protests, as we know. That after the Second World War, going back to my original statement, something came into being called the Nuremberg Code, which had certain component parts, and there were, I think, 10 things, but basically the doctrine of informed consent for medical experiments. And so you had to be informed and you had to consent. The consent was the aspect that was related to your autonomy and your freedom. But you also had to have the information with that. And I noticed during COVID that the doctrine of informed consent went out the window because of an emergency. It was declared an emergency. It was a healthcare emergency. Don't question the science. Are you questioning the science? So there was a lot of vilification that was going on. But the medical community itself dropped this ethical standard for its own conduct in order to help people. And that is an accelerant, to go to your point about cause and effect. It caused the acceleration of this deterioration, or this rush towards euthanasia in Canada, in a way that it hasn't in other countries. And so I'm not a political scientist, but I think the fact that Canada has embraced this and has lacked the ability to resist tyranny from politicians and from the medical establishment is itself a test case, and will be studied by other nations, but probably not our own, because it's politically unwise to raise those issues here. It's almost un-Canadian to question it. No, I mean, truly. Are you questioning that? Because if you're questioning Canada, then you're coming at it from a hostile political angle. Even if you're not fronting it as a political angle, it's taken as a political issue, even when it's not even intended that way. And that's because life has been politicized. Now, this is go back to what I said at the beginning, the science is taking over the humanities. Human life has been politicized to the nth degree, and there is no area of private and public life now which is not subject to politics, and that includes our very privacy of our homes and our rights and freedoms. That was a sort of a watershed moment. And anyway, I do think it has some connection with this issue of euthanasia and its advance, and the planned society. And we are full of conditioners in this country. We love and regard ourselves as the most civilized people on earth. And because I studied the Nazi era, spent years in Germany as well, they too thought they were so, and were regarded as such. The most highly educated people in all of Europe, which meant the world, were the Nazis. They read great books, the books that I promote. They read those books. Didn't stop them from doing a thing, because they'd been hollowed out. They were, by the way, what happened in Germany, Hitler was envious of what was going on in America and Canada and in Britain on the eugenics front. He was envious that they were doing these things there. They far beyond what they were, and he wanted to catch up to them. People don't realize it. Tommy Douglas, the founder of the Canadian medical healthcare system, wrote his master's degree on eugenics. He was not a monster. But eugenics is a monster. Euthanasia comes with it. It just does.
I think that Canadians need an encounter with Christ to reset, to offer a vision that is not hedonistic and or not even hedonistic, but that isn't self-focused, where there's the possibility that suffering has meaning. So, I mean, I think that, I think Canadians are hungry for meaning, for Christ, for a deeper offering, for something that isn't utilitarian. And so I think I can have hope that culture and law comes to reflect that, but my first hope would be for revival, that could then spring out of. Yeah.
But it's cause and effect. So the revival, the appeal to call people to Christ can happen in the defense of human liberty, the human life, human dignity, because God is man as well. So I gave a talk not long ago called The Anduril Moment, when I talk about reforging the broken sword of the humanities, which used to be tethered to theology and then got separated from it in the 18th century and banished from the university. You can't study theology in the university now, and the humanities aren't humanities anymore, they're human sciences, and they've separated. So you can study theology in the seminaries, but you can't study it in the universities, so that you never hear the voice of Christian theology articulated as such in the universities, because it's methodologically by the Guild forbidden to talk about matters of religious conviction in an objective fashion, because those are private and not to be said publicly. But in the humanities, the theology, the seminaries, they don't consider the human nature side of things, even though Christ's human nature was the most important aspect of his being from our vantage point. The fact that he was born of a virgin, and he lived a human life, and he suffered, and he died, and he rose. Those are human events, and he lived a perfect human life. That aspect of human nature needs to be recovered by the Christians. And you got to defend the human, and when people want the human to be defended, they don't care about religious doctrine referring to God. It seems abstract, impersonal. It doesn't apply to them, they think. They just think, oh, you're just talking about that stuff. You think, no, I'm talking about how important that Christian theology is for human life. That's what they're not hearing. But that is the reality. Christ comes and shows compassion for the poor. He reaches out to people who are his religious enemies. He touches people who are unholy. He hangs out with thieves and beggars, and is amongst those that are in his inner circle are women. And they give testimony to some degree within the gospel accounts of the first eyewitnesses of the resurrection. All of those things are transformative. And Christians early on, they rescue people from off the streets, babies that have been left exposed. They adopt them as their own family members. So those are stories that need to be told and need to be replicated, and I think they are. But we need to realize that that is an aspect of the gospel outreach that people want to hear. They want to know that Christianity is about human living now, and it will make a better world. That anyway, to your point.
No, I'm really glad that you jumped in to say that. Just in terms of, I mean, I even think a Christian response to someone seeking MAiD, compassion and conviction that life is worth living may draw people to Christ. So it's not separate. It's. I mean, Jen Zimmerman's book, Incarnational Humanism: A Philosophy of Culture for the Church and the World, is a great text on that precisely, in terms of the ways in which Christ's incarnation imbues humanity with meaning, and Christians living that out will be winsome, will be attractive. So it'll have the net benefit of perhaps reforming the politics, but it'll have the first benefit of drawing people to Christ.
Can I comment too? Thank you. That was a really good question. I'm certainly not as well versed in politics as these guys or theology, but something that's been on my mind and heart recently is I try to do my best to keep up in other fields, and interdisciplinariness is very important to me. But since doing my doctoral work and realizing the role of the faculty of imagination, I've been starting to think about, as C.S. Lewis says, like this idea of a sanctified or baptized imagination, and what that can do for us as believers about thinking and imagining something new and beyond us. And my all-time favorite book is The Space Trilogy by C.S. Lewis, and it's 3 books. And the last one is called That Hideous Strength, and it is a sci-fi take on the abolition of man, which is exactly what we've been talking about today. And it's such a fantastic book, but there is one beautiful line that, and literally all his language is like kind of from it. You're just trying to steal from Lewis, aren't you? Let's be honest here.
I took the sci-fi and subcreation class from him that text is taught in. So anyway.
So I'm just. So there's this beautiful quote in it that says, "You do not fail in obedience through lack of love, but you've lost love because you never attempted obedience." And I think as believers, obedience to the Lord is so scary sometimes because it's out of control, it's unknown. These are the first time in 39 years I've been wrestling with, like, what is value? What is happiness? What are morals? What is virtuous? What is a virtuous emotion? And I've been praying for imagination, for a baptized and sanctified imagination to get there. And so I think, to your point, is like, how can we ask the Lord to allow us to see something beyond what is here? Because if we're sticking to this, we get so caught up in this. This feels hopeless. And even as we're talking, I'm like, I like choice. I don't want to be in pain. Like, it is so hard to say. Like, I teach a course at U of A, and to put my stance up against, like, I have choice, I deserve choice. I'm like, yeah, you're right. Like, it's so hard to rebut some of these things because it makes sense. And so I think, again, your question was so fantastic, is how do we pray for an imagination that sees things the way God sees things, to be inspired to reach out into other disciplines and learn, have these conversations. I think this is where it starts. So anyways, thank you. Thank you.
Are there any final questions from the audience for this evening? No? All right. Well, with that, I'll leave you guys if you have any final closing thoughts, and then we'll wrap up our panel for this evening.
Thank you for the great discussion. Thanks for hosting us.
All right. Can we give a round of applause to our panelists, please? Thank you all very much. I hope you all had a lovely and wonderful evening. You're dismissed now. We'll have some refreshments at the back if you're interested, for some time of fellowship and further discussion if you're interested. Thank you. Have a great night.